Hello and welcome to this short tutorial on GI oncology. We're going to just quickly go over some aspects of colon, rectum, liver, gallbladder, and pancreatic cancers. So colorectal cancer is the second most common cause of cancer and cancer death in the United States. It is more common in blacks and appears in men at a younger age than in women. Most colorectal cancer is sporadic or it's associated with a positive family history. A mutation of the APC gene results in familial adenomatous polyposis, which is the most common hereditary cause of colon cancer. Lynch syndrome, which is also known as hereditary non-polyposis colorectal cancer, is associated with the DNA mismatch repair, but it only accounts for 3 to 5% of all colorectal cancers. Screening has greatly reduced the incidence of colon cancers, and many people with colon cancers have been screened for genetic factors. This has identified those who are carriers, allowed their children to be tested, and screenings to begin at even earlier ages, resulting in even earlier detection and treatment. Colorectal polyps can be adenomatous, which are neoplastic or cancerous, or hyperplastic, which are completely benign. Neoplastic adenomatous polyps are premalignant and can be classified further as tubular villus or tubulovillus. Polyps larger than 1.5 centimeters are more likely to be malignant, and serrated sessile polyps are associated with oncogene mutations, and that's what's shown here. Colorectal cancers tend to grow slowly and often take years to invade the submucosa and metastasize. This allows for successful excision and decreases the need for chemotherapy. Rectal cancer accounts for about 30% of all colorectal cancers and can easily invade the prostate in men and the vagina in women due to easy penetration through the lower third of the rectum, which has no serosal covering. Metastasis also occurs more easily by direct transmission through the hemorrhoidal plexus, which drains directly into the vena cava. The liver is a common site of metastasis, but after it's affected, it is the leading cause of cancer death. It is more common in Eastern and Southeastern Asia, more in blacks than whites, and more in males than females. Primary liver cancer is more frequently associated with hepatitis B or C infections and is most common after the age of 60. Hepatocellular carcinoma is cancer of the hepatocytes and is classified by the degree of involvement, nodular, massive, or diffuse. It is associated with chronic hepatitis and cirrhosis and most commonly metastasizes to the heart and lungs, although it can also metastasize to the brain, kidney, and spleen. Cholangiocellular carcinoma, which involves just the bile ducts, is very rare and occurs most often in Southeast Asia because of liver fluke, which is a parasitic infection. Cancers in the gallbladder are generally adenocarcinomas, which are malignant tumors that arise from glandular structures in epithelial tissues. Less commonly, it can be caused by squamous cell carcinoma. It is most often associated with gallstones, obesity, anomalous pancreobiliary ductal junction in older people, and it also occurs about twice as often in women as in men. Chronic inflammation can trigger dysplasia, which then further develops into metaplasia. There is genetic mutation and alterations in extracellular matrix. Due to proximity, liver and lymph node invasion occurs early. Infection and invasion of the stomach and a duodenum are complicating factors. Pancreatic cancers unfortunately have almost a 100% mortality rate at 5 years post-diagnosis due to the rapid spread, and that symptoms usually do not occur until after significant tissue invasion has occurred. The rate raises with age. It is more common in males than females. It's more common in the black population than in the whites. Although the cause is unknown, most pancreatic cancers arise from the exocrine ductal cells and are adenocarcinomas. Risk factors for pancreatic cancer include a combination of genetic and environmental processes, as well as associated disease states. Resistance to conventional treatments is in part from activation of pancreatic stellate cells, which are a type of fibroblast in the pancreas. Inflammatory cytokines from chronic pancreatitis support tumor growth. Tumors in the head of the pancreas can quickly spread and infiltrate to the superior mesenteric artery, the vena cava, and aorta, and can form emboli. Tumors in the tail can invade the posterior abdominal wall. The lymphatic system is usually invaded early, and venous invasion causes metastasis generally to the liver. So again, this was just very brief and quick, 5-minute kind of update. It's just there wasn't much information in your textbook, so I just wanted to give you a little bit of additional information. Please let me know if you have any questions. Thank you.